Since it was launched in 2011, the Wolfson Economics Prize, worth £250,000, has only been awarded 4 times. The most recent was last night. Its aim is to find new ideas that challenge orthodoxy in economics and public policy. And this year's question was, how would you design and plan new hospitals to radically improve patient experiences, clinical outcomes, staff wellbeing, and integration with wider health and social care? It's a question that rather obviously couldn't be more relevant, touching on many of the most pressing issues that face the NHS today: waiting lists, waiting times, staff retention, and of course social care. Well, last night a winning plan was chosen from the shortlisted entries, and I am joined by the winner, Ab Rogers, and by one of the prize's judges, Laura Lee, who is Chief Executive of Maggie's Cancer Centres. Good afternoon to you both.
Hello, Sarah.
Hi, Sarah.
Am I right? It is Ab Rogers, is it, or is it Abe?
It's Abe.
Abe, I'm sorry, so sorry.
I'm very relaxed about these things.
Well, it's good to have you on the programme. And first of all, congratulations. Can you describe for us what your proposal is for a hospital that basically so impressed the judges?
I think our hospital is really designed around the human experience, and we try to see it more of a health centre or a living system that tries to create prevention as much as cure. But at all times, it takes both the staff and the patient to the centre of the design. For example, patients lying in beds always look out a window rather than looking at another patient. Out of the window, they can see a tree, and there's always access to balconies, so you can sit in fresh air, which speeds up recovery. It really goes back to a lot of Florence Nightingale's principles, Alto's principles. It's nothing radical, but we have we've reworked the system so it kind of fits into the contemporary city.
And it is. I mean, from the look. Sorry, just it's very. There's a lot of glass, which is perhaps typical, but it's also modular. I mean, this is something that sort of you could plug together, isn't it? And I think the thinking is that it would be right within a city or within a town.
Well, we see the hospital as being a kind of tool for urban regeneration. We've seen the demise of the city centres, and by growing these hospitals in the centre that cater for prevention as well as cure, and create a much greater experience for the doctors, nurses, and the staff, as well as for the patients, we believe we can start to change the role of the hospital.
Okay.
Retain staff for longer. Sorry.
Well, no, that's okay. I mean, it's wonderful to hear about it. Let me turn to Laura Lee, though, because she was one of the judges. And Laura, what was it that most impressed you about the design?
I think it impressed us because of it considered the building as doing a job of work. It's a carer in itself. And we know, as you mentioned when you opened, is that staff retention, how do we have the workforce of the NHS, whether or not it's the kitchen staff, the cleaning staff, the porter, the nurse, the doctor? How can we give them an environment that uplifts them, that makes them feel valued, that makes them want to come into work? And then it's the patient and the relative experience. The moment that they approach the entrance of the hospital, that they're greeted and welcomed in a place that they want to be in, that they know that they can feel safe and valued. And so it's taking those kind of different components and making the building then support that excellence of healthcare.
Okay, so it's on paper now, this hospital. Mm-hmm. Will it ever come into fruition, Abe Rogers? Is it something you will actually design for somewhere?
We would love to design it for someone, and we would love to see it to come into fruition. But more than that, we would love to see the thinking and the discussion become more part of the everyday. Our design has come about for a real kind of collective intelligence, talking and listening to doctors, to nurses, to hospital workers, as well as patients. And I think it's going away from this notion of the big idea and trying to create a much more sympathetic response, which responds to the human that uses the space. And that's the kind of change that we really want to make but beyond the single building.
Well, Dame Laura, it's something you're very familiar with Maggie's centres, where they sit alongside hospitals, the importance of getting the environment right. There is a rebuilding programme for the NHS infrastructure. Can you see that this actually might make a difference, the awarding of this prize?
Absolutely. I mean, what's so critical about the prize is not just Abe's fantastic winning submission. But the other submissions had nuggets of golden opportunity for the NHS New Hospital Build programme to learn and develop from, so that our hospitals today and tomorrow that we're going to be building can be better places for healing and care and, as Abe said, cure.
Dame Laura Lee and Abe Rogers, congratulations again, and thank you very much for telling us about it.